Dear colleagues, friends and partners, it is a pleasure to welcome you to today's event, Closing the Gaps in Stroke Care, a call to action for Europe. Stroke is Europe's second leading cause of death and the number of cause of long-term disability. It affects millions of families each year, and yet stroke still remains on the margins of many national and European health strategies. Stroke services across the EU are woefully inadequate, resulting in high rates of preventable death and permanent severe disability, along with a deep-rooted sense of abandonment among millions of stroke survivors due to the absence of supports to rebuild their lives. That must change. Today is not only a conversation, it is a call to action. As the European Commission is developing the European Cardiovascular Health Plan, we must ensure that stroke is placed firmly at the heart of that plan. Why? Because the evidence is clear. Stroke prevention and treatment are cost-effective, scientifically proven, and essential for public health. And because stroke, cardiovascular and brain health are inseparable, what protects our hearts also protects our brain. But across Europe we continue to see serious inequalities. Too many people do not receive timely access to dedicated stroke units. Too few stroke survivors get the rehabilitation they need, and too many national systems still lack a structured pathway that supports people from prevention to life after stroke. That's why we are here today, to bring together experts, survivors and policymakers, and to make the case for coordinated EU action. We need EU-level leadership, national commitment and real investment in prevention, acute care, rehabilitation and follow-up. Let this be a turning point. Stroke must no longer be treated as an afterthought. It must be recognized, prioritized and addressed in the upcoming European Cardiovascular Health Plan and beyond. And there are cost-effective solutions to these critical deficits set out in the Stroke Action Plan for Europe, created by Stroke Alliance for Europe and the European Stroke Organization, for which EU-level support is vital. Thank you for your dedication, and I wish you fruitful discussions ahead. Thank you very much.